Hi, my name is Wendy. I'm a student nurse at the University of Manitoba, and today we're going to be giving my patient cefazolin and antibiotic through the CIVA method. Just to give a history of my patient, she came in with pneumonia, which is why we're giving her the antibiotic to fight off the infection. I'm just going to get started into my first check. So I have Emma Wrightson, the right patient. The number is 1, 2, 3, 4, 5, 6, 7, 8, 9. She's 30 years old. Her allergies are shellfish. She's giving cefazolin, which I have right over here, cefazolin, 650 milligrams. I have a 1 gram vial, so I'll have to do some calculations to dilute it. Right root is IV, and we have right dose right root IV here every 8 hours, so it's 9 o'clock, which is right now when it's supposed to be due. I'm just checking the expiration date. It's not expired, so we're good to go on that. But just before I get started, I'm just going to look at the monograph. So we have the right drug again, cefazolin antibiotic, and it can be given by a student nurse. So the usual dose is 1 to 2 grams IV, and I have a 1 gram right over here. Our maximum single dose is 3 grams, and our maximum daily dose is 12 grams. So I just have the 1 gram vial here, and the order is for 650 milligrams, so we're safe within the range. So we are going to be reconstituting it, and it says for our 1 gram vial, we will reconstitute with a 9.5 mils of sterile water for a final volume of 10 mils. And then looking just at the CIVA chart, for cefazolin, for a 1 gram vial, I'll have to give 10 milliliters in a 10 ml syringe. So I did my calculations earlier, and with a 1 gram vial, when we reconstitute it, I'll be pulling up 6.5 mils. And according to the CIVA chart, in order to get the 10 mils in a 10 ml syringe, I'll have to pull up 3.5 mils of normal saline, and I'm going to give normal saline just because it is compatible with the primary infusion line. As well, we are giving it a CIVA method just because the patient has a past medical history, does have AKI, so we don't want to fluid overload her. So giving the CIVA method will just be 10 ml along with the fluids that she's already getting. So just to get started, I'm just gonna be reconstituting my medication. So I just want to perform hand hygiene. I just want to swab the ports to make sure they're sterile, and I would want to swab it for a full 30 seconds clinically, but for video purposes I won't be doing that, and I would, again, clinically would let that dry for 15 seconds before I get started. So I just want to get my syringe and my needle ready, and I want to maintain sterility. So we are injecting 9.5 mils of sterile water. So I just want to pull out 9.5 mils of air. I'm just going to inject that into my sterile water. So I'm going to push my air in, just pull back. I just want to make sure my needle point is below the amount of water in the vial. I'm just going to get rid of some bubbles.
And then I know my normal saline is compatible with the timer bagging.
Make sure that I have the right dose.
So my normal saline is being packed.
Oh, and then I would just inject it right into my medication vial. Put in the full 9.5 mils. And I just want to let my syringe pull up to make sure that all the medication isn't still and none of it will come back up. Perfect. So I'm just going to do my scoop method.
And then we're going to withdraw our...
And I just want to roll the vial to make sure that the drug gets just mixes in with the dilution. Alright, we're good. So I just want to be re-swabbing just because it was in my hands, and just make sure that it is sterile again before pulling up my medication. So again, 30 seconds clinically, but for video purposes, I'm not going to do that. So we need 6.5 mils of the medication now. So I pulled up my 6.5 mils of air, and I'm just going to inject it all in. And I'm just going to pull up the 6.5 medication. And again, I just want to make sure my needle tip is below the amount of fluids. And I'm going to just tap out some air bubbles.
Before entering my patient room, I do a safety check. There's no tubing on the floor, and I'm just going to.
So we have 6.5 right there. And again, I'm just going to scoop up my method. So we have 6.5. So before I move on with further diluting it into the 10 ml syringe, I'm just going to be doing my second check. So I have Emma writes in the right patient, FIN number 123456789, allergies, shellfish, right medication, cefazolin, 650 milligrams, and I have 650 milligrams over here. IV for right root every 8 hours, so that would be 9 o'clock, which is right now. So now that my second check is done, I'm going to be flipping to my CIVA chart. And so I have 1 gram, 10 mils in a 10 ml syringe. So like I said earlier, we're going to be using normal saline just because it is compatible with the primary infusion line that's currently hung in the patient's room.
There's your call bell. If you just call and then I'll come here. So then can I just check your outfit?
So I'm just going to grab my normal saline vial.
And then how old are you?
And I want to swab
So I'm gonna
the
check
top
your
for that as well.
It's not swollen.
So again, 30 seconds clinically and let it dry for 15 seconds. So I'm going to pull up 3.5 mils of normal saline over here. Go. And I'm just going to inject it here. I'm just going to pull up 3.5 mils of normal saline. Get rid of some bubbles. Perfect. And I'm just going to do my scoop method. Now I have to be putting this diluent into our medication, and because there's a smaller volume over here, I'm going to be injecting it over here. So I just want to pull back, make sure that all my medication's in the syringe, and I'm just going to remove the needle here. And again, I just want to pull back even more to make sure that I have the right amount of fluid, because we will be getting 10 mLs. I'm just going to pull it beyond the 10 ml port. And then I'm going to inject this needle in here, put in my 3.5 mils of normal saline, and then I would do the scoop method. And I just want to recalibrate that back up. So you have the bleb. And then to maintain sterility, I'm going to be using a blue cap instead.
So now I'm just going to put the port and let that dry. I'm going to put the one closer to the boat.
So I just have my pre-made label already right over here. I have the right patient, Emma writes in. I have the drug name cefazolin, the dose 650 milligrams IV. The volume is 10 mils. Today is October 16th, 2018 for 9 o'clock administration. And then my initials, WMUMSN3.
So now I'm
going to attach that on here. And so now we're ready to enter the patient's room. Upon entering, I'm going to introduce myself and just give the patient a little background of the medication. So before going in, I would just perform hand hygiene. I should do a little knock, knock, knock. Hi, my name is Wendy. I'm going to be your student nurse for today. Today we're here to administer sulfazoline. It's an antibiotic just for the pneumonia that's going to help fight off the infection. Some types of symptoms you might experience will be a headache, nausea, vomiting, diarrhea. Again, if any of that were of concern, then you just let me know. I'm just going to double check to make sure that everything looks good. But to start, can I get you to state your name? Am I right, Sen? And your PIN number 123456. And can you tell me your date of birth? Perfect. And I have your allergies right over here for shellfish. Just checking the IV site. There's no phlebitis or infiltration. The IV site looks good. It's patent. I'm just going to look at the line. Seems to be flowing well, and I have the right medication. Perfect. And upon entering the room, I did check for safety checks. There's nothing on the ground, however, I will be putting up the side rails before I leave. So I'm just going to do my third check before administering the medication. So I have BW for amorexin, which I checked with the armband, sulfazoline, 650 milligrams. 650 milligrams in a 10 ml syringe, 10 ml for the volume, giving it IV, so we're good to go. So I just have my tubing line that I'm just going to pull out.
Miss Emma, could I get you to repeat your full name for me? And your date of birth? Okay, perfect. We have the right pieces.
Just want to make sure.
I'm just going to check over the IV side again. Make sure there's no sense of infiltration, not too touch or too warm, no redness. Emma, do you have any?
So I'm just going to be inserting my needle, my syringe into the port.
Now it's time. Just keep going. Yeah. Check. We have the medication here.
Perfect, so that's good to go. So before giving it to the patient, I just want to make sure that I'm priming the line. And we have a bleb right over here, so we're good to go.
Okay, so Miss Emma, you have the right to refuse the medication.
So I'm just going to grab another alcohol swab.
This is a steroid, it's inflammation due to your rheumatoid arthritis.
I want to maintain sterility and not get this
So
port.
you're good to give the medication.
Not let it touch anywhere, so I have my alcohol swab. Now I'm going to be picking this port to give just because my patient does get a few IV push medications, so I want to make sure that that line is accessible still.
Okay. So I'm going to untap make sure
So we're good to go. And then I'm just going to grab my
spicy
machine, open that up,
and we are going to spike everything.
make sure that it's all secure in there. I'm going to turn it on. So I just press start normal because that's what the CIVA chart said. It said to start it on normal, and it said 26 minutes, so I'm just lining it up here. We are at 26 minutes. I just want to make sure that I see the 3 flashes to make sure that the machine is working. That's 3, the audio alarm is on. So just for my last critical thinking point, I would want to stay with my patient for about 5 minutes just because this is a new medication for her. She has never had it before, so in case any allergies were to happen, want to make sure that I'm here to combat that. And then I would, before I leave, I'm make sure that everything's good, it's not unclamped, everything's opened. After I leave and I come back, I'd want to come back in about 10 minutes just to make sure that the medication is infusing, that there are no complications, no bubbles, nothing of that. And then I'm just going to document that real quick.
And we can run our program hours.
9 o'clock, and then my initials, UMSN3.
Is
So again, I'm just going to reassure my patient
volume to the
Mrs. Watson, so your Brayson, your medication has been administered. Again, any signs and symptoms, you might be feeling a headache, dizziness, diarrhea, nausea, or vomiting. If you have any of those sorts, your call bell is within reach.
So everything seems
I would
to
make
be
sure
running.
that the line is actually reachable. Before leaving, I'm just going to put up the
If you are
side rails.
experiencing any side effects like dizziness related to low blood pressure, feeling a little bit down, you can
If they were to go up, I would put the side railings up, making sure that our patient's not in distress or anything.